September 14, 1987, Wall Street, New York City. 17 protesters chained themselves to the entrance of the New York Stock Exchange. They're demanding one thing: access to experimental AIDS drugs. Police arrest them one by one. This is ACT UP, the AIDS coalition to unleash power, and they're done waiting politely for the government to save them. Because while Washington slept, an entire generation was dying. Episode 4, ACT UP Fight Back, When Silence Became Death. Let's talk about what wasn't happening. President Ronald Reagan didn't publicly mention AIDS until September 1985, 4 years and 12,000 deaths into the epidemic. When his Surgeon General, Dr. C. Everett Koop, wanted to send educational materials about AIDS prevention to every American household, the White House blocked it. Funding requests for AIDS research were repeatedly slashed. The CDC's AIDS budget was cut even as cases exploded. Internal memos later revealed the Reagan administration saw AIDS as a gay disease that wasn't politically worth addressing. While politicians debated whether gay men deserved help, 20,000 Americans died in 1986 alone, another 28,000 in 1987. The numbers kept climbing. Someone had to fight back. Larry Kramer was angry, and he turned that anger into action. In 1981, Kramer co-founded the Gay Men's Health Crisis, GMHC, one of the first organizations to provide services to AIDS patients. They organized volunteers, delivered meals, and raised money. But Kramer wanted more than charity. He wanted a revolution. In 1983, Kramer wrote a scorching essay in the New York Native titled 1112 and Counting. If this article doesn't scare the shit out of you, we're in real trouble. Our continued existence as gay men upon the face of this earth is at stake. Unless we fight for our lives, we shall die. Their logo, a pink triangle, became the defining image of activism. Once used by Nazis to mark gay men, it was reclaimed as a symbol of resistance. ACT UP had one simple message: we're dying, drugs exist that might help, and the government's bureaucracy is killing us. In 1984, Dr. Anthony Fauci became director of the National Institute of Allergy and Infectious Diseases. He was 43 years old. But Fauci did something remarkable. He listened. He invited ACT UP members into his office. He learned about their lives, their desperation, and their rage. Fauci pushed for streamlined drug approval. He argued for parallel track programs that would allow dying patients access to experimental drugs before full FDA approval. Over time, Fauci and ACT UP formed an unlikely alliance. The firebrand activists and the government scientists, united in fighting both the virus and the system. In San Francisco's Castro district, the heart of gay America, AIDS was decimating an entire generation. Memorials for the dead were in every window. Nancy Pelosi, elected to Congress in 1987, represented this district, and she arrived in Washington with a mission. Pelosi became Congress's fiercest advocate for AIDS funding. She fought for housing, for research dollars, and for the Ryan White Care Act. Between 1987 and 1995, federal AIDS funding increased from $341 million to over $1.4 billion annually. In 1987, the FDA approved the first drug to treat HIV, AZT, or azithromycin. Finally, a treatment. AZT worked by interfering with reverse transcriptase, the enzyme HIV uses to copy its genetic code. If you block the enzyme, you block the replication. But AZT was a nightmare. Side effects were brutal: severe anemia and muscle wasting. Patients had to take it every 4 hours around the clock. Most frustratingly, AZT didn't work for long. HIV mutated rapidly, developing resistance within months. It bought time, but it wasn't a cure. By the end of the 1980s, the landscape had shifted, but HIV was still winning. The death toll was approaching 100,000 Americans. For many, legal channels weren't enough. Some began taking matters into their own hands, smuggling experimental drugs across borders. Next time, we'll see what happened when patients became pharmacists. Visit unbedsidemanners.com for more stories.